Hi, my name is Stephanie Spicer and I'm a Limey. I'm not a doctor or a scientist. This video is just an attempt to explain a scientific concept in layman's terms. It's not medical advice. Limeys often ask questions about how to treat certain symptoms, but the problem with trying to treat Lyme symptoms individually is just there are so many different symptoms. Trying to have a treatment plan for each one is a little like trying to juggle dozens of balls in the air at the same time. It's almost impossible to do. You'll drop some and some will interfere with each other. You may become so overwhelmed that you just give up altogether. A much better plan is to just go straight to the root cause of all the symptoms, Lyme disease. If we focus on treating Lyme, our body will decide for us which symptoms to tackle in which order. Many Limeys describe the phenomenon of moving backwards through their symptoms as they treat, meaning the symptoms they acquired most recently are the first to be dealt with, while older symptoms get worked through much later down the treatment road. I can definitely attest to this. When I started treatment, I had just started getting some really disturbing psychological issues, and luckily they cleared up pretty quickly. Now, years later, some symptoms that I first experienced as a child are popping up again to be worked through. Some describe this experience as peeling off the layers of the onion. The reason Lyme treatment takes this pattern is because of how the layers of the onion are formed in the first place. When we first contract Lyme, it might affect us at a pretty superficial level, and we may feel like we have the flu. If we don't beat Lyme disease at this point, the flu symptoms will eventually subside, not because our immune system has beaten the bacteria, but because the bacteria have gained territory that our immune system has given up to them. Every time we feel sick from Lyme, a battle is going on between our immune system and the bacteria. When we feel better again, it's an indication that our immune system has lost more ground and the bacteria have settled comfortably into their new territory. Lyme disease is not static. It will continue to advance as a disease as long as we don't challenge it with treatment. Each time our immune system loses a battle, the Lyme becomes deeper entrenched in our body, moving into new areas and building up new layers of the onion. When we do treat, we notice the same pattern but going in the other direction. Each time we do a treatment, we kill a load of bacteria, usually in the area or level most recently conquered. And so we regain our ground, like an army taking its country back from enemy invaders. You might notice symptoms coming back that you had completely forgotten about and realize that you're actually much sicker than you had thought. But the good news is you're moving forward, not backwards. The layers of Lyme are being peeled back, not added on. So keep on fighting, Limeys, and don't give up. Keep on fighting until it's over.